Hi, I'm Susan Taylor with Scripps Health in San Diego, California. Do you have pain in your abdomen, changes in your bowel movement, maybe diarrhea, constipation, or both? You might have IBS, Irritable Bowel Syndrome. How do you diagnose and treat it? Joining us to talk about this is Dr. Chiara Maruggi. She is a gastroenterologist with the Scripps Clinic Medical Group. Doctor, thanks so much for being with us.
Thank you so much for having me.
So there's lots of things that would cause your stomach to be upset. What's the difference between that and IBS?
That's a great question. Well, there are many things that can cause someone to experience abdominal pain. Irritable bowel syndrome is really a chronic condition that affects how our gut works. It's often characterized by abdominal pain at least once a week for several months, with changes in your bowel habits, which could include the change in form or frequency. Of course, it's always important to rule out other conditions that can also come in with abdominal pain. So it's very important to talk to your doctor if you're experiencing any GI complaints, particularly if it's lasting several weeks to months.
And there's three different types of IBS?
Yeah, so the Rome 4 criteria, it's a standardized set of guidelines that we use to diagnose irritable bowel syndrome, and it does break down IBS into different subtypes depending on the stool form, and these can include IBS constipation, diarrhea, or even mixed.
And how common is IBS?
IBS is quite common. It's estimated that approximately 12% of the US population suffers from this condition. Some data suggests that the incidence of IBS may be on the rise, and that may be due to improvements in our diagnosis of the condition, but also potentially due to the changing lifestyle and environmental factors.
And who is most at risk?
While we're still learning a lot about IBS and its genetic and environmental links, we do tend to see IBS more commonly in females and oftentimes in people under the age of 50, though IBS can certainly present at any age. Anything that disrupts the gut-brain connection can increase the risk of IBS. So chronic stress, anxiety, depression, even prior trauma as far back as childhood, and fibromyalgia can increase the risk of IBS. Disruptions in the gut microbiome may also trigger IBS, so GI infections and even antibiotic exposure can be potential risk factors for this condition.
Is there a genetic component? Let's say a parent has it. Does that make you more likely to have it?
Great question. So IBS is a very complex condition, and there are certainly genetic, environmental, and psychological factors that have important roles in the development of IBS. Recent research has shown that offsprings of parents with IBS are at higher risk of developing the condition, and there are ongoing studies that are trying to shed more light in the genetic factors that can predispose patients to the development of IBS.
So how do you diagnose IBS, irritable bowel syndrome?
So the diagnosis of IBS is really a clinical diagnosis. So it's really important that you speak to the doctor, and especially if you're having abdominal pain that's happening once a week for several months, and you're noticing a change in the stool characterization or frequency, you should go in to speak to your gastroenterologist, and they may order blood tests to rule out other conditions and make the diagnosis of IBS.
So how do you treat IBS?
Treatment can include many things, including dietary changes, lifestyle changes, and even medications. And it's really targeted based on the symptoms that are characterizing your IBS.
And what is the FODMAP diet?
So FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols.
That's quite a name.
It certainly is. So these are food groups that are poorly absorbed in our gut and can lead to abdominal bloating, pain, and even changes in the bowel habits. Common high FODMAP foods are things like wheat, onions, garlic, milk, even artificial sweeteners. Studies have shown that patients who follow a low FODMAP diet have a significant reduction in their IBS symptoms. So I always warn patients that the FODMAP diet is really quite restrictive. So the goal is not to have patients follow a low FODMAP diet forever, but rather to identify which high FODMAP groups cause the symptoms and then try to avoid these in a maintenance phase of the diet.
So can IBS be cured by changing your diet and seeking psychological help for the trauma that you might have had earlier in your life? Or is this a chronic condition?
So IBS is really a chronic condition, but certainly the goal of treatment is to manage a symptom so patients can go on to live a normal life. At different points in someone's life, treatment may need to be adjusted or tailored, but that's why it's so important to have this therapeutic relationship with your physician so that you can adjust your therapy based on how you are feeling at that time.
So what is IBS versus celiac disease?
So celiac disease is really a gluten-sensitive condition. Patients with celiac disease will have a reaction to gluten, and that's found in things such as bread, cookies, pasta, pizza, anything that contains wheat will cause these patients to have GI symptoms such as diarrhea, abdominal pain, weight loss. But certainly, celiac disease can present in many ways. So if you are having symptoms, particularly after eating wheat-containing foods, it's important to speak to your doctor, as there is a blood test that can be done to rule out celiac disease.
So when should you go see a doctor to figure out what's going on if you have these symptoms?
So really what I say is that anytime you're concerned, we're concerned. So when you have any symptom, particularly any pain, discomfort that's lasting several weeks, or it's worsening, you really should speak to your doctor about it. Primary care doctors are a great first resource for patients, and they're always accessible. But if you have any questions, our door is always open as well.
Any final thoughts, doctor?
Well, I just wanted to say thank you so much for having me here today and taking the time to discuss this really important and common GI condition. I hope that this encourages patients to seek help if they're suffering from symptoms of IBS or have any other GI concerns.
Doctor, thanks so much for being with us. We appreciate you taking the time.
Thank you.
If you want more information on how to diagnose and treat IBS, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.